Hi, everyone. Welcome back to the Finding Genius video series. Before we kick off this conversation, I just wanted to thank TriNet for sponsoring this conversation and many more and all the work that we're doing here. So, a quick note about TriNet. TriNet helps thousands of SMBs scale and lower their burn rate by offering a tech enabled HR platform that streamlines employee benefits, payroll, and HR compliance. If you'd like to learn more about TriNet, feel free to reach out directly to me, or you can contact Ray Allen Zekis over there as well. I hope you enjoy this conversation. Thanks again. Hi, everyone. Welcome back to the Finding Genius video series. I'm joined with Florian Otto, the founder of Cedar. And Cedar is a patient payment and engagement platform that elevates the experience beyond clinical care. Cedar recently raised $102 million Series C, led by A16Z, with participation from funds including Thrive Capital and Founders Fund. Florian, thank you so much for joining us today.
Thank you for having me. It's a pleasure.
Could you, just to kick off the conversation, I think what would be helpful is maybe telling us a little bit about yourself. And I know you started off your career, or at least startup career at ZocDoc. So sharing a little bit about your journey from there and the insights and the genesis towards Cedar and how that all has kind of worked out over time.
Sure, very happy to do that. And ZocDoc was actually my last career, so maybe let's start from the beginning. So as you can hear from my accent, I'm from Germany originally and studied medicine and dentistry and was a maxillofacial surgeon. Did my PhD, so a pretty academic career doing surgeries in the face. And then during my studies in the end, I already did a few internships at McKinsey Company and then decided to join McKinsey full-time after graduating and moved to Brazil. So was a healthcare consultant there, a lot of providers, payers, government healthcare. Did that for 2 years and then started the company in 2010. Same business model as Groupon. And then Groupon bought the company and I became CEO of Groupon Brazil. So did that for 3 years in total. And that was in Sao Paulo. Wow. And then 2013, I moved to New York and joined ZocDoc. Initial idea was to be head of international, but then we changed it and I became head of sales. Okay. So moved to New York, was for 3 years head of sales. And then, to the beginning of 2016, started Cedar.
And what stage was ZocDoc in at the time?
So ZocDoc just raised the Series C. Okay. By DST. So it was basically, I think, 180 people. So it was already a growth stage company.
Wow. And head of sales, so who were you selling to? Was that to doctors' offices at the time, or were you focused more on enterprise?
Yeah, good question. So when I came, we actually had purely on local doctors. So it was a very large sales team doing transactional sales into local practices. But what I did during my time, we launched our enterprise sales team. So enterprise sales team is to hospitals. It's really doing larger enterprise agreements. Okay. Both sales teams are super separate from each other because it's a very different sale that you do. Enterprise sales, very different from transaction sale. So in the end, we had both.
Okay. And could you share a bit more about Cedar beyond all the press pieces that people have seen, but what led to that inkling of an idea that you said, okay, I'm going to quit and go and start this full time? It's your second company, yes. So I guess you already had the entrepreneurial experience. So.
Yeah, happy to share a bit more about that. Actually, more a personal problem or situation that I faced. My girlfriend at that time, right now my wife, she fainted on the street and needed to go to the emergency room. And then typically experienced swipe credit card for the copayment, and then got be treated really amazingly by the medical team. And then a month later, got a stack of paper in the bill, in the mail, all in different codes written, and she had problems paying that over the portal because they somehow didn't really work with Google Chrome browser, and she needed to call in order to pay it. Then another month later, she got an invoice from the imaging center where there literally was a slip of paper where she needed to fill in her credit card information in order to pay. And then half a year later, a debt collector called her for an invoice for the lab company, and she never received that. So what happened is she changed her address, and they billed her old address. And of course, terrible experience. So what did I do? First of all, she told me never take me back to that healthcare provider. So, okay, I somehow understand that. I mean, if the billing is so messed up, you're afraid of the medical side. And she said, yeah, absolutely. So next thing I did as an entrepreneur, of course, you challenge the situation. Why is it so messed up? So you look on Yelp or Google reviews and you see it's a big problem. It's not only her. So it's a huge problem. And then you try to understand, okay, why is really the problem so big? And the very interesting piece is the following. You talk to a healthcare provider right now, and they say the problem is either the willingness or the ability to pay of the patients. And we started challenging that, and we found out, okay, it's actually neither nor. In general, patients want to pay their bill. And in general, patients can pay their bill. There's a very interesting stat that says in the US, there are 50 million people that have a bad credit score because of medical debt. 50 million. It's crazy. Wow. 1 out of 6. But even more interesting is that half of them have otherwise a clean credit score. And the median outstanding balance is $200. So clean credit score, $200. That is not ability to pay. It is a process problem, right? And then, of course, makes total sense. And you know this, what are patients really used to? We sometimes hear, oh yeah, but healthcare is different. But you know what? The consumer is exactly the same. The same patient goes to the hospital, that shops on Amazon, that watches Netflix, that books a trip on Expedia or Kayak. So it needs to be exactly the same experience. And that's what they are used in these other consumer technology. And then right now, they have a very different experience in healthcare.
What was the problem on the US side that at least led to this issue with billing and codes and cash flow problems, specifically in the US health system? Why was it so convoluted? Is it a regulatory issue or something else?
Yeah, it's an interesting question. So overall, it's a two-part problem. The one is, of course, regulation. But with regulation, I would just say how this health system is set up is very difficult. Because you have different co-payments, you have co-insurance and deductible, which are 3 things. And then you have a very difficult insurance system because you have different in-network and out-of-network charges.
Okay.
So all of that complicates it a lot. But the fundamental system, all of that could be even fine. But combine that with an antiquated technology system. And the technology, for example, is, you know what, it's actually not that surprising. So I told you the analogy, for example, to travel. It was exactly the same in travel. You have these big ERP systems, which are enterprise on-premise software like Sabre or Amadeus, right? They're all good because they're aggregating a lot of data. And then you have the traveler. But the traveler cannot access these systems because the UI doesn't work. So in between, you have the travel agent, brokering. And then that got modernized by Kayak, by Booking.com, by Expedia. And in healthcare, it's actually exactly the same. So you have these big EMR companies, which are on-premise. They're written in mumps or in COBOL, so pretty antiquated languages. They update once every 18 months. So it takes a long time for them to update. They are fine for the clinical workflow, but there's no chance consumers can really interact with them because their user interfaces are very antiquated. They don't really can interact with them. They cannot personalize. They cannot iterate fast enough. So there's a big discrepancy right now.
And in your experience in Germany and Brazil, are the health systems there just much further ahead based off the technology and the systems that they've put in place, or is it just the US system has just become more complicated than it needs to be?
Yeah, it's an interesting question. So I don't think that they are much ahead on the technology side, but the big problem or the advantage is they don't need to be ahead. So for example, in Germany, there's no patient balance because patients don't pay anything. So the interaction actually with the patient and the healthcare system doesn't really need to happen on the administrative side. They build the insurance company and you're done. And that's most of the case in Brazil as well. Brazil has, 80% or 85% is done in the public system. Their IT system is completely antiquated, but they don't bill the patient because everything is basically for free there. The private system is actually pretty good in Brazil. Also, the IT systems are really good, but they have a very small network and they're usually integrated payer and providers.
Okay.
So it's not necessary.
Right. And then, so when you started this and you were discussing this problem with your wife and trying to figure out all the issues around it, what was the first steps that you took in order to launch this and decide to go and do it full time?
Yeah, I think the first is we of course really looked on what are the fundamental problems, right? in the fundamental problems, we just basically said, okay, why should healthcare billing be different than, I don't know, shopping on Amazon, watching Netflix, or booking on Kayak or Expedia? And, or for example, hailing an Uber, right? And we said the following. I mean, in this on-demand economy, everything needs to be convenient. Everything needs to be immediate. Everything needs to be, of course, personalized and mobile. And healthcare billing is neither nor, is nothing on that, right? It takes you 2 months to get your bill. You get it in the mail. That's definitely not a good consumer interface. It's, of course, a one-size-fits-all solution. And that also all doesn't make sense, right? I mean, if you right now open your Amazon account, it looks different from mine, right? When you look your recommendations on Netflix, they're very different from mine. That makes total sense because those companies understand that consumers are different and they're individual. So what we basically did is we adopted top-notch user technology from other consumer industries and adapted that to healthcare. So what we built was the following. We said the first pillar on where everything should rest is it should be a good user interface. It needs to be beautiful and it needs to be transparent. So what does that mean? It's, of course, the first is the phone, everything on the phone. You get a text message or an email or ringless phone call. No app to download. Nobody wants to download an app in order to pay the bill. Login. Usually these portals have username and password. Everybody hates to set up a username and password. Why not doing two-factor authentication, right? Then we're merging different builds together in one interface. We are translating all the codes into human understandable English. And then we just literally adopted other great things, like, for example, FedEx Track Your Package. It's pretty good, right? We like it. So we adopted Track Your Bill. So you know exactly where are you right now in the billing process. That reduces anxiety for the patients. So it's extremely important for the patient to really understand, okay, where are they in the billing process?
Right. Sorry, no, go ahead.
Then other things, for example, if you have a question, an Uber, you can just click the boxes and have a 24-hour chat. We adopted the same. So we built a chatbot, and then you can pay with Apple Pay, with Google Pay, with PayPal pretty easily. Get then afterwards set up a payment plan and so on. So that's the first pillar. We want to make it consumer friendly.
And since this is such a heavily regulated space, there's just there's so many players trying to attack it from different directions, and then politicians are also changing the rules. How, as an entrepreneur, do you navigate it? What are the biggest regulatory hurdles that you're facing now as a company, or you did, and how did you overcome those? For other entrepreneurs that are building healthcare companies, there's a certain way of navigating this and a certain art. So how did you think about that early on?
Yeah, totally. And I think, it's super highly regulated. The interesting piece is that most of the regulations actually make sense. Okay. So it's actually not, there are a few regulations where we need to comply with. The first, of course, is HIPAA. That's basically patient privacy. Some of the HIPAA rules are pretty antiquated, but in general, they make sense. So in the end, if you always have the patient's best interest in mind, you are fine. So data needs to be secure. You need to do a two-factor authentication. We always have ourselves audited by companies externally to really verify that we are high trust certified. Okay. And that, of course, makes sense. And there are other rules, like, for example, the TCPA, Telecom Consumer Protection Act. We need to comply with that. And then PCI compliant, of course. Do we need to be there?
So these are primarily engineering problems as opposed to major legal issues.
Exactly. Otherwise, legal issues, there are no legal issues. You can bill patients, right? That's what they currently do. They just do it extremely patient unfriendly.
And did the idea resonate with them immediately? Or how is the sales, since you've led sales at ZocDoc and now you're doing it here through Cedar, how is the value proposition for them?
Yeah, it's of course interesting. So health systems, I think, are not the fastest movers. And there are a few reasons for that, right? So it takes a lot of time to really get the first, and it's always in the beginning the chicken and egg problem in any enterprise software, right? Everybody in the beginning says, oh, that's cool, but show me results. Because in general, nobody cares about our software. Everybody cares about patient satisfaction, about the collection rate, about the time to collect, and the cost to collect. It's the magic four, right? And in the beginning, you have nothing to
Yeah.
show. So you somehow, of course, in the beginning, need to get the first few customers excited about it. And how do you get that? Not about the results, but about the technology itself. So you basically show them the demo and how the product works. And back to the point on what differentiates us, the beautiful user interface is one part. And the second, which is the real crux of it, is this personalization. Every single patient gets a different bill at a different time with a different copy. And that every way on how you click through the app triggers different follow-up messages. And that is the real crux of everything. And health systems actually understand that on the medical side, because personalized medicine is nothing new. That's already practiced by 20 or 30 years. So you need to get the first few health systems on. And then you need to implement the software. And then you need to show the results. And when you have few results, then you can go, of course, to more health systems. And how you do that on a business-wise, the first you just need to get these early adopters, no question. You don't go to the largest health systems first, but go to the smaller ones. And then you have case study for the smaller ambulatory groups. So you can go all the way on all the ambulatory groups. And then you try with all these results on the ambulatory side, you get into one health system. And then you have a portfolio of ambulatory and health systems. And then you can go to the market. So it's a classic crossing the chasm where you literally try to get the early adopters, and then you go down the bowling alley, go deep into your group, and then you build a portfolio of clients. But is it easy? Absolutely.
And are these health systems, are there certain health systems that you've seen to think more innovatively about healthcare and the new products that are out there that are pushing the tape, or are many of them just still stuck in kind of the old ways of doing things?
Yeah, it's a good question. So first and foremost, I think almost every health system says in general it makes sense, right? If you show them what Cedar is, and very few health systems says, okay, how we do billing right now is fantastic. You almost never hear that. And almost every health system says it makes sense. That's good news. That doesn't mean every health system says, okay, let's adopt this. So what are the health systems that of course want to move? So I think there are a few fundamental things that prohibit health systems to sign up. That's, for example, if they do a huge integration of another health system because of a merger. That's usually just distractive. And then they say, okay, they don't want to do an upgrade right now of that. Second might be they're doing a huge upgrade of the ERP system. So this EMR records or electronic medical record systems. Then they literally say, okay, it's not the best time to do this. Capacity constraint on the IT side, that happens. So the best health systems are, of course, the ones that have the capacity on the IT side to do the integration, that are the ones that are more innovative and forward-looking. And there's, in competitive landscape, it is, of course, always easier because they are somehow fighting for market share. And when they fight for market share, they fight for patient experience. So they want to elevate the patient experience. And that, of course, makes it much easier.
And shifting gears, so talking about that patient experience, how, besides the beautiful UI and things that you've put together, what else are you doing to foster some of that patient engagement in the process? Or what else are you adding them in terms of value beyond what your wife experienced of tracking her bill? How does this change healthcare from the consumer standpoint?
Yeah, it's a few things. So, of course, there's the let's call it the back-end billing process 2.0, what we do. So that means that everything when you get your bill, that's more beautiful, that's more intuitive, that's simpler, and it's personalized. That's already great and delivers great impact. We develop products on top of that, which goes away from the post-visit billing experience towards a post-visit resolution. What does that mean, for example? Sometimes your insurance gets denied. It's just basically you get a huge bill of $10,000 because the healthcare provider had a problem with the insurance information to submit that. So we would text you and say, take a picture of your insurance card and we resubmit that. That, of course, helps a lot. Second is charity care applications. Some patients are not enrolled in something like Medicaid, but they would be eligible for it. So we guide the patient to that. And then the third is denials messaging. If your insurance gets denied, we help you walking through the process. So that's all to become basically user experience after the visit. Our next big product, which we launch actually in a few weeks, will be our pre-visit. What is a pre-visit? So you get a gentle reminder of your appointment. From there, you can do the check-in experience already to the health system. Can take a picture of your insurance card. We do a real-time eligibility check. You can get an estimate of how much you owe, and then you can pay already before the visit exactly that.
Interesting. Okay.
And all of that together, of course, helps the patient a lot, because we literally virtually take the patient by the hand and walk the patient through the entire process. And we strongly believe, and that's what we see on the patient feedback, when you reduce the friction everywhere, the patient experience goes up, because the patient are in difficult situations. Most of them are sick, and they do not want to deal with all this administrative hassle. They want to focus on getting healthy again. And that's where we can really try.
So what are you as a sales team or management team, actually management team is probably a better way of phrasing it, focused on in terms of KPIs for the business? Is it number of patients that are using the software? Are you tracking providers? What else are you looking at on a daily basis?
Yeah, it's a great question. Of course, we're tracking a lot of metrics, but I think the number one metric, and that's interesting, is not revenue or sales or something. It's the number of invoices resolved at a high patient satisfaction.
Okay.
Because in the end, our mission is to improve the healthcare financial experience for patients. Right. We want to improve it, because the experience of my wife was terrible. And the more patients we touch, and the better we have the experience, that is kind of our North Star.
Right. And how are you measuring patient satisfaction, this engagement with the?
Yeah, it's actually not that difficult. We always have surveys after every bill. And kind of like Uber has it, you have 5 stars, or we have a thumbs up, thumbs down. And what we see right now is that 96% of the patients give us 4 or 5 stars or thumbs up. So it's pretty high for an experience that, you know, in past, healthcare billing had a lower NPS than visiting the DMV. So it's kind of it's the red-headed stepchild, right? Nobody really wants it, and it is revolutionary to make that just patient friendly.
Are you willing to share, or are you able to share at this point how many patients or things that you've touched at this point, or would you either wait on that?
Yes, we are right now on track to have around 10 million patients. We are interacting with, so it's an extremely high number. And of course motivates us. So you always have, as an entrepreneur, you know this, you always have some down days where you say, oh my God, it was so stressful. I need to travel again. And I spent the night at the airport. But then when you look in these situations, I literally scroll through all the patient feedback and see on how grateful patients are when you just have a great experience. And then of course the quantity is also extremely motivating.
Interesting. So switching gear a little bit, can you talk about that? You've kind of accumulated some venture funds that every entrepreneur would dream to be working with. Andreessen Horowitz, Founders Fund. Can you talk a bit about your fundraising process, pitching them this idea and building up the syndicate with some strategics involved to work best for the company with this massive Series C that you guys just took in? Can you tell me a little bit about working with them and the pitch process too?
Sure. You're asking specifically about right now the last financing round on general fundraising?
I guess both, actually, and the genesis of how the entire fundraising has gone since the seed for you all. And then
it sounds good. Because the reason why I'm asking, because I think it was a little bit different in the beginning versus right now the Series C. So in the beginning, our first round, as you mentioned correctly, was Thrive Capital, and then Series A was done by Founders Fund. So when you talk to those investors in the beginning, there's very little metrics you can share. So it's much more problem focused, and it is founding team focused. So problem focused is actually not that difficult. When you have more than 2 or 3 people in a room and you ask, tell me about your last medical billing experience, I can guarantee you there's 1 or 2 people who said, I was in collections. I hate it. It's the worst thing in the world. Okay, so far so good. Then you explain the quantification of the problem. And that is one thing barely anybody knows. So experience is bad, but right now the quantification of the problem. Healthcare billings, patient to hospitals, is per year $150 billion. That's a lot of money. Average collection rate is 40 cents on the dollar.
Wow. 40
cents on the dollars, 150 billion collected. So you're talking about a market that is like US e-commerce minus Amazon. It's a pretty big market. So bad consumer consumer experience, large market. Okay, you need to staff a winning team. And definitely, I think my co-founder takes a big credit on that. He is a brilliant technologist and product leader. So you basically need to say, this is your approach. So the fundraising was much more on that. So getting the investors excited about the vision, about the problem, about the scale of the problem, and about the team to tackle it. And that's what I would say literally was Series C and Series A. So last financing round, of course, when you go to Series C, it's very different. It still needs to be, the investor needs to be excited about the problem. But it is, and about the team anyway, right? That's, I think, in every stage. But on top of that, you, of course, need to show that you have a lot of commercial traction and that the customers are happy. So it's much more when you go to the later stage, like the A16Z round, they, of course, got very thorough on what are the metrics right now of the business in terms of how many patients do you serve, what is your revenue, what is your growth rate, what is the satisfaction of the patients, what is the satisfaction of the customers. They did a lot of reference checks, literally calling to hospitals and asking, how is Cedar doing? Are they helping? What is churn metrics, cohort analysis? So it's much more numbers driven because we are talking about a later stage company and also more money.
That's very helpful. Thank you. So before we run out of time, I wanted to ask a more important question now about the COVID crisis. And I think given this would be helpful to people that watch this video, given your experience in healthcare and you've been working on it for so long, both as a physician or studying to be a physician, and then at ZocDoc and now at Cedar, could you talk a bit about what the COVID crisis has revealed about our healthcare system in the US? And what are areas that you're now more excited about, or what you think will be needed to strengthen the entire system as a whole, besides billing?
Of course, yeah. I think it's an interesting question, and first and foremost, I think the COVID crisis is a public health crisis and a humanitarian crisis, right? And of course, it is absolutely terrible on what would it cost to society and also to the healthcare system. So what did it reveal? I think a few things. So I think a few things on where the US healthcare system is specific in comparison to others. And yes, of course, the big out-of-pocket piece is a problem. Right. Capacity of the healthcare system, we also see that. Countries with a larger capacity of health systems are faring better, like Germany, where I'm from, for example. They have much fewer deaths because the capacity of ICU beds, of ventilators, and so on is much higher. The most interesting piece is right now what happens and what will change in the health system, I think, in the short term and in the long term. So a few things. I think the first is we also did a customer survey, a patient engagement survey, and we found out that around 50% of patients delayed medical care. That's an amazing, staggering number. So people don't want to go to the healthcare provider because they're afraid of getting infected. So care gets away from out of the four walls, more towards the virtual. So of course, healthcare systems right now, they're adopting telemedicine. Makes total sense. They want to engage with the patients digitally. And that's not only on the medical side, but also on the administrative side. So Cedar is, of course, helping with all of that.
Florian, this is very, very helpful. I appreciate you taking the time.
It was fun. Thanks a lot for all the questions.
Thanks a lot. Talk soon.